free. And then Tracy, will you be monitoring the chat for questions or comments in the chat?
I will.
Thank you. So hello, I'm Mario Moreno. I've been a therapist for how many years now? About 10. Worked for Baycare since 2012. Mostly in crisis stabilization and in addictions at varying different levels, including outpatient, residential, inpatient, detox, in hospital settings as well. And I'm a licensed therapist, and currently I am providing education for Baycare's psychiatry residency program. But I'm still working with Tracy in the employee assistance branch as well, and I love taking a break to give these webinars. So happy to talk about this stuff. Happy to talk with anyone afterwards. Also, I can put, when I'm done, I'll put my my Baycare email in the chat. So not a lot of time, right? We have like a half hour. So a lot I do want to talk about. So let me just jump right in. All right, so some quick, because we always do this, right? We start with some stats, some quick substance abuse stats that does sort of justify why we talk about these things as much as we do, because it's important, right? And substance abuse, addiction, substance misuse, the whatever terminology makes the most sense to you, it affects all of us. So approximately 8% of the population, 12 and over, have some kind of a substance use disorder in a given year. And that could be a mild disorder where they're, using more than would be considered safe or recommended. But it could be treatable, and it could be something that maybe does seem to, maybe they get help and you don't really notice it. Or it could be something really chronic and tragic. So I'll go over the range of what we're talking about here in a bit. Use of alcohol or drugs does not mean a person has a substance use problem. I always make a point of throwing that in here when we're talking about substance use. This is not one of those things like if you're joining this and you have plans with some friends this evening, and that those plans might involve going to Applebee's or whatever and getting a margarita. That does not necessarily mean you have a substance use problem. If when you're done with margaritas at Applebee's and all your friends leave and go home to their families, and you go to another bar and then another bar after that, and wake up hungover the next day, but it's kind of normal for you, blame it on allergies, right? That could be more of a sign of a problem. But just because someone indulges in something doesn't mean we're talking about addiction. 75% of people who develop substance use problems do so by age 27, generally sets in earlier in life. There's probably some reasons to that. As we allow ourselves to grow and emotionally mature, you could imagine that perhaps the chance of developing addictive behaviors could be lower. And so one of the reasons why we're so worried about like youth substance use, for instance, is that they haven't really had the chance to have their brains grow up, right? And so they don't learn to self-regulate as well. Now, the good thing is, I have a slide on resilience too. The good thing is that you can always start healing. You can always start growing. So it's not like if you started using and before age 27, you're just doomed to be an addict for the rest of your life. Not necessarily at all. But yeah, we do definitely see the vast majority of people develop addictions before age 30. Alcohol use disorders are almost 3 times as common as other substances. You can probably imagine why, right? It's available, it's legal, it's socially acceptable. and it's very addictive too. Is the other part of that. Okay, so when the title of this presentation is "Loving Someone with an Addiction," and I'm going to go through some warning signs that, if you're worried that someone you care about might be developing addictive tendencies, or behaviors, or you're noticing some things. I'll say usually if you're worried and if you're paying attention, the worries might have some merit. But it is good to go over the kind of the facts, right? So addiction warning signs can include increased use over time, increased tolerance for the substance, difficulty controlling use. And that could look like someone says, you know what? I've been drinking every weekend for the past 2 months. This weekend, I'm going to dry out a bit. And then the weekend comes, and then all of a sudden they have reasons why, you know what? Yeah, I can't miss out on whatever it is, right? And then the next thing you know, the pattern continues, right? So, like, often one of the pretty regular signs of difficulty controlling use is just someone sort of saying, "Nah, I'm not going to do it," and then they do it anyway. And you can think about that across the spectrum, right? That's true for other things too. I mean, like, I could tell myself I'm probably not going to have the last piece of key lime pie that's in my fridge tonight, and I'll probably end up eating it, right? So it's just a matter of how dangerous the thing is that you can't control. Symptoms of withdrawal. I kind of flippantly talked about having folks who kind of wake up with a hangover every day, but maybe just kind of blame it on allergies or something like that. Is someone seeming relatively sicker recently, and it's not explained by something else, right? And you also know that they happen to be involved in some sort of substance use, and that tolerance goes into that as well. Severe symptoms of withdrawal involve things like hair of the dog, right? Like, which is more of an alcoholic kind of term, but not being able to function without actually having the substance. You see that a lot with opiate use. Preoccupation with the substance is someone's whole life kind of revolving around it. And along with that, giving up important activities. Are they making sacrifices at work? Perhaps with work opportunities. I've known someone who didn't take a job because it started at 7 a.m. and they're like, well, I can't be up at 7 because the reason was that they were going to be hungover at that time. They needed their morning recovery period. So yeah, like, are they giving up important opportunities? Are they giving up social opportunities? Are they not doing something because they know they won't be able to drive to it or something like that? Are they spending all their money on more expensive substances like cocaine? And even if they should be able to afford things, they can't anymore. Again, not explained by other issues such as the economy. Is family taking a backseat to substance related behaviors? Continued use even after recognizing problems. Someone gets a DUI and the next thing you know, they're drinking again. And not every DUI is a sign of alcoholism, really. I mean, like, sometimes people, it's their first time drinking in a long time and they make a dumb decision to drive, and they pay the, bad roll of the dice to pay the consequences for it. But, like, you would think that if that happens to somebody, that would scare them away from drinking for a while, right? So someone who perhaps has that sort of thing happen or has a major, they're on some substance. It's not always alcohol, right? Various opiates, pills, again, cocaine, even marijuana, right? And it causes a problem. It causes a fight. It causes breakup. It causes issues with work, right? There's consequences, but they continue to use. That's a pretty good sign. Um, so there's something called the Jelinek curve, not to be confused with Anthony Jeselnik, the comedian, but it sort of just describes the different phases and includes, this is very important, recovery, right? So the progressive phase, someone's maybe not just having fun anymore, but maybe starting to self-medicate, right? I wasn't going to drink today, but it was a really stressful day and I need a drink. Again, that's not a sentence that everyone who says that, that doesn't mean that you're necessarily addicted, but is it happening more and more? In the crucial phase, it's that's when you want to try to catch it because the behaviors are starting to get out of control. There are consequences, but life is still manageable. In the chronic phase, it's really not anymore, and there's a little circle at the bottom. It's a cycle. Um, then we get into the rehabilitation phase, which is usually, I mean, historically, they would say people have to hit rock bottom. I don't know if that's necessarily true. We hope people don't have to hit their rock bottom in order to agree to get help, but often comes after some level of consequence. That could even be just, a medical thing. It could be emergency trip to the ER, and the doctor says, I understand that you're young and you like to party, but this is really bad for your heart or something like that. Some kind of a wake up call. Oftentimes it's several of those. That's why it's a cycle. And someone can just once someone's in that chronic phase, logic doesn't really work. And you would hope it would, but you can really kind of run yourself ragged trying to reason with someone who's not yet ready to make the change. But people do have their moments where they are ready to make change. And then we get into the rehabilitation phase, which is a struggle. Like it's really hard to get sober. After a while, recovery does tend to level out. It's still a lifelong sort of thing, and that's why, like, if you know someone who's in recovery and they say things like, "Look, I can't have one drink," or maybe there's someone who's in recovery and they go to like AA meetings or something like that, you gotta support that. Even if, because you might think, well, you've been in recovery for 10 years, you kicked that a long time ago. Hey, it's New Year's Eve, have some champagne. Support their sobriety because it doesn't necessarily always just last, and that's part of why we consider it a mental illness or disorder, right? Like, not to say something negative about people who struggle with addiction, but it's like it's not just a behavioral choice. So I'm going to try to get through this slide because again we're already 15 minutes in, but here's some things we know about substance misuse and addiction, very abridged. I always start with this one because the family members I've talked to over the years are very often so baffled. Why? Why would this person who's a good person, who I care about, who I love, who I know loves me, who I know loves their family and their livelihood and themselves, why would they continue to do this? And we got to remember drugs feel good. That's not me endorsing drugs. But drugs and alcohol, with alcohol is a drug, but colloquial we say drugs and alcohol. First and foremost, they feel good. They provide something to people, and people who have been through a lot of stress, people who have been through a lot of trauma, people going through physical pain get relief from them, right? It makes sense that someone would try to feel better quickly. That's just human, right? So of course it develops into something that's out of control, and it develops into something that creates more problems than you were originally trying to medicate. But it starts there. So people don't just choose to become addicted, right? Like, not all misuse leads to addiction. You got to remember that too. Not every overdose is a sign of addiction, even. That was something that, like, when I worked in inpatient medical settings, in the ER and on units, sometimes you would have someone come in after a night of partying and things did not go well for them, and the staff would very often jump to the conclusion that this person has an addiction, and it's on the one hand, I wouldn't say ever discount it. It's a fair thing to think, but it doesn't necessarily mean it, right? We just got to treat people like individuals. We got to get to know them and get to know what's going on behind their particular use without trying to just make assumptions. Substances have their place in culture. I mean, there's commercials for you can watch a YouTube video about sobriety and see a commercial for like Tito's vodka or something, right? Like it's just in our culture. Now, spiritually, substances have a place too. And those lines can get sort of crossed over time. But it's just good to kind of keep up with marijuana, for instance. Now, I'm not going to get into is it good or is it bad, but it certainly is a lot more accepted now. And that comes with its complications, right? It's nice that people might not be getting arrested for having marijuana on them, but also it is addictive. And so as a substance's place in culture changes over time, the problems relating to it change too. The vast majority of addictions clients reveal a history of trauma in treatment. So that's one of those things we kind of know post hoc, right? Like we don't know for sure that everyone who's an addict has a trauma history, but I can tell you from working in treatment settings, it always comes up, right? So that doesn't necessarily mean that if you've experienced some sort of emotional trauma, major loss, or physical trauma in your life that you're doomed to become addicted to some chemical, but it is a factor. And I say that also to say, like, just for our own well-being, if that applies to you, you've been through something traumatic, and you notice that some sort of substance really helps you not think about that thing, that's something to be aware of. To practice moderation. Don't let it get out of hand because it will. Okay, I'm going to move to the next slide. That kind of covers some of these things. Well, I sort of went over this already, but just when does it become a problem? In the mental health field, we measure if substance use is a problem, if it's impacting someone socially, legally, as far as family functioning goes, spiritually, or as far as their community functioning goes. And that also includes like values, like are they sacrificing their own values or just not paying attention to them anymore? Everyone's values are different, but it's important that people stay true to their own values, right? Employment and education, financial, physical health, mental health. It can be kind of a vicious cycle. I mean, like sometimes it is the case that someone's addictive pattern or habits started because they were trying to help themselves feel better from a mental health condition. And sometimes that, I mean, everyone's got their problems, but maybe it wasn't a serious mental health condition at first, but after years and years of addictive cycles, they develop what is now a pretty serious mental health condition. You're trying to come off of something like a benzodiazepine or alcohol or marijuana. Those things suppress the nervous system. Coming off them, your nervous system is going to feel very unsuppressed. It's going to be going, right? So someone who's newly sober is probably more anxious than someone next to them who never had an addiction problem. And that is something that's worth paying attention to. So I think I'll probably end on this slide because I want to make room for questions too. Thank you all for joining, by the way. I really appreciate it. Seems like we've had a consistent number of people here, so I appreciate that too. So how do we practice love for someone who has an addiction? And I really should have added in this top line something to include loving ourselves. That can't stop while we're helping someone else who is struggling. Recognizing addiction, learn to accept it as reality. Right, like it's when we talk about acceptance, we don't mean like we're allowing it or we're even forgiving it or we're being complacent to it. It's just like, is this the reality in front of you, and are you willing to acknowledge that it is? Um, Determine your own boundaries, make them known, let the person know what you're willing to do, what you're not willing to do, and try to be true to your values when doing that. Don't try to control or fix the other person. Encourage them to seek help. I think of it as very often a lot of these things are like, if you if you see a stray cat outside your house and there's like a hurricane coming, and the cat looks friendly enough and you're willing to let it inside so it doesn't get swept away in the storm, but it's a scared cat, right? Is it helpful to go running out after it even though you have the best intentions in the world? Probably not. Right? What do? We leave the door open, we leave some food outside the door, not even inside, outside the door. We coax it in, right? We make it feel safe. We show that we're not a threat. And when someone is stuck in the throes of addiction, no longer using that substance is a threat to them, right? That's scary. Think of like if you had something that helped you, and I'm not saying it truly helps them, but if you had something that you believed helped you get through every day, and everyone around you wanted you to not have that thing anymore, I don't know, maybe it's your car. Maybe it's a piece of cake that you have at the end of a long day. Maybe it's water. I mean, there's been studies that show that people who are craving their substance of choice feel pretty similar to people who are dehydrated, and they will do the same stuff to get it, right? So if they know that everyone around them wants to not have that thing, well, how would you feel if everyone around you wanted you to not have the thing that gets you through the day, right? So let's try to be gentle, be supportive, be encouraging, but not demanding. Um, and so along with that, we go to like let's just stop blaming, right? Like, and that's one of those functional things. Like, yes, fault could very well be a factor, but it's often not helpful to talk about. So let's just stop looking at like, you know, well, you wouldn't be in this situation if you hadn't made those choices. It's like, okay, they did. They made the choices. They're here, right? And let's stop blaming ourselves too. We all make mistakes as well. Let's try to allow ourselves to move forward and allow the other person to move forward. Um, Learn the difference between helping and enabling. You're gonna make mistakes. You're gonna think, you know what? I know I'm not supposed to enable this person, but if I just help them pay off this last loan of theirs, then they'll not have that financial stress anymore, and they'll feel a lot better. And then you do it, and the next thing you know, nothing changes in their life, right? Like it'll happen, but just try to be aware and accept the fact that you've made mistakes when it comes to enabling. Try to educate yourself on it, reach out for help, learn to spot manipulation. You'll make mistakes there too. You'll think someone's being manipulative when they're not, because you're so tired of dealing with it at some point that like your wires get crossed, right? Um, so recognize that self care doesn't equal being selfish, and that's for yourself too. You got to take care of yourself. If you're loving somebody who has an addiction, you need to love yourself as much, if not more, and that means not feeling guilty for taking time away, setting boundaries, treating yourself.
Mario, I hate to interrupt, but I have a question that came in. I wanted to make sure that we get to it.
Yeah.
And the question is, the line between helping and enabling are often so blurred. And I have patients who have children with addiction. The emotional manipulation that they deal with can be extreme at times. How do you counsel parents on how to deal with this scenario?
When it's really extreme manipulation, then the boundaries have to be like really, really firm. And the way I talk about this sometimes is you have to set a boundary that doesn't feel right to you, because what feels right has not been working, right? And like that can sound a little bit harsh, but if you think about it, um, the reason we don't have good boundaries is really because we're good people who care, right? And so then we conflate it in our mind to say that like, oh, if I say no, or if I stick to this guideline that I set, and I stick to this consequence, or I said I was going to call the police if there was drugs in my house. There's drugs in my house, but I don't want them to get arrested, right? Like we think. Ooh, I skipped ahead, but that's fine because we're talking about it anyway. Like we think that we're being a bad person when we're actually sticking up for ourselves. So you do need to kind of explore what feels wrong to me. I hope that helps. But changing habits often feels wrong. So the other part of it is with extreme manipulation, you have to and it can help to write down the things that the person might say to you to be manipulative, right? Like write down whatever it is. Oh, you don't really love me or something like that. And just, keep your own journal of what sorts of phrases you might hear so that when you do hear it, you can support yourself because manipulation works and we all do it. We all manipulate to some degree. We all try to get what we want from other people. And it's not a failure of yourself for falling for it. Like it's a really, really useful tactic to stay in the throes of addiction. So give yourself some grace, but also recognize that it's gonna feel wrong to stick to your boundaries at first. I did well, let's see, where are we at? Okay, we have like a minute left. So
I'm sorry, Mario, we have one more question.
Yes.
Is it okay to ask our loved one that is in recovery if they've gone to a meeting lately, when it seems like they're struggling again?
Yeah, I'm gonna say a blanket yes. Now, what I will say is, for those who have loved ones in recovery, try to establish that as a ground rule ahead of time, right? So even right now, like if someone who's in recovery and they're doing great, just go to them and say, "Hey, by the way, I went to a seminar today, webinar, whatever, and I was curious. Would you give me permission to ask you if if you're going to meetings, if I'm ever concerned?" Right? And then you have that on the table. No, but if that hadn't happened and it's just the situation you're noticing now, then yeah, just come at it from a place of concern and a place of love. Come at it from a place of curiosity. Mention how you feel. Mention that you had some difficulty even asking. Hey, by the way, I really didn't want to ask you this because I feel like it's maybe not my business, but I really need to know. It would put me at ease. Talk about how you feel. Your feelings matter, after all. But those kinds of I feel statements, they do draw the person in, as opposed to if you were to come to them and be like, "Hey, I'm a little bit worried about you. You go to those meetings, right?" Like then the person's immediately on the defense. So the answer is yes, but it's like, how do you do it? And I suggest looking up. There's articles on techniques like motivational interviewing. That's the sort of thing that doctors and therapists learn, but it's also a thing that the layperson can also learn. And there's so yes, ask, but from a place of concern and openness about your own feelings, from a place of vulnerability, if that makes sense. Any other questions?
Yes, I'm sorry I couldn't unmic fast enough. My son is in active addiction, and it is very hard not to feel guilty because we had a rough childhood, because he had a rough childhood, excuse me. What can I do to get rid of the guilt?
Well, the cop out answer that is also a very true answer is to seek your own therapy, right? It's like that's one of those things. Like, of course, I'm going to say that, but I mean it. And also, uh, Tracy maybe can talk about the employee assistance program. The good segue there. But also, so every therapist is going to have their own kind of spin on it. I come from the school of cognitive behavioral therapy. I think of it as functionally, is that guilt helping you? Right? Because guilt is a useful feeling. If I step on someone's toe and they exclaim in pain. I hope I feel bad about that. And then I stop because I feel bad and I ask, for one thing, I apologize. I ask how they're doing. I ask, can I help in any way? And ideally, I mean it, right? Guilt is a great feeling sometimes, but is it helping you now? Um, is it the right feeling for this situation? Is it something you can perhaps deal with on your own while not giving into manipulative behaviors and feelings of shame? Because shame is not useful, right? Guilt is I did a bad thing, I'm trying to fix it. Shame is I'm a bad person. That's not helpful for anybody in the world to think, because it just tends to lead to continuance of the behavior. So so it's worth doing your own counseling and like kind of like exploring, has that guilt turned into an unhelpful feeling of shame, and what are you doing about it? Are you helping the person, or are you kind of like just staying stuck in your own guilt, which is not helping them or you? Something else I think about yourself, think about people you love, um and maybe people you might have some resentment towards. Would you want them to feel guilty for the rest of their lives, or would you want them to maybe fix a problem, right? Like, so it's good to think of it that way too. Like, um, guilt isn't really a virtue, and it's often something that even the person struggling with addiction, in their moments of clarity, such as when they're like on a detox unit, I've met with many of them, they don't want you feeling guilty. They want you moving forward and maybe helping them, but not just suffering and guilt. Tracy, anything else? I know we're over time, but I
Um,
don't. Were
that
you able?
seems like the questions for now. I know it was short, and this is certainly a topic that we could really deep dive into. But
Yeah.
we appreciate your words, Mario, and the information that you shared. I did post Mario's email address. You are welcome to email him questions if you would like to do that. He's more than happy to answer your questions. Any final thoughts from you, Mario?
No. I see, Tracy, that you posted the EAP information in the group chat.
I did.
So hey, if y'all don't know about it already, use it. It's free, and